can overcome unexplained infertility. What are you still waiting for? Kindly register and have a consultation with our specialist. You too will carry your own child. You can reach us by registering on our website, georgiafertility.com.ng, or give us a call or WhatsApp on 080 69 01 91 77. See you soon. Hello there. Have you been trying to get pregnant for the past 12 months and unable to conceive after? Don't worry, we have good news for you. Do you know, here at Abebe Fertility Center, we have over 260 couples who have been confirmed pregnant from the Be Fruitful project and are currently on their way to parenthood. Do you know, with IVF, you can overcome unexplained infertility. What are you still waiting for? Kindly register and have a consultation with our specialist. You too will carry your own child. You can read.
I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you. I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you. encourage those of us who are Daddy, this illustration, I'm the one that connected, but I've logged out. That somebody will not come and then you just click on this. How do you? I don't get it. I should do what? So I leave it on. Oh, I I should put join and just leave it on. Okay, good afternoon, everyone. Once again, I want to start by apologizing for starting well behind schedule. We were supposed to start by 12:30, but we had some technical difficulties. We were trying to get some clients, some potential clients that were on a group to join on this interactive session. We only to discover that the video call that you could do on a group was no longer there. I don't know if WhatsApp had upgraded their system. All right, so we have posted the link on that group so that individuals on that group can join our face group our Facebook page to follow on this interactive session. So once again, you're all welcome to this month's Fertility Forum. It's a forum we hold every month that provides an opportunity for us to interact with our potential clients, to give them information about us as a fertility group, and then to be able to provide education and provide a platform for questions to be answered. And we try to target couples who are trying to achieve conception, or those who may have people who are trying to get pregnant. My name remains Dr. John Abebe. I'm the medical director of the Georgia Abebe Fertility Center and the president of the Georgia Abebe Arts Foundation. You're welcome. So this fertility forum is, like I said before, it's a monthly event that occurs, and it's in collaboration with the Georgia Abebe Fertility Center to provide a platform for education on human reproduction. And then it also introduces the support system that is available to couples at the Georgia Baby Art Foundation. And then we also try to introduce the system and the processes that we follow at the clinic to ensure that couples who are trying to get pregnant, they're able to go through the process. So what we do basically is to provide you with all necessary information as much as possible, and to give you an opportunity to ask questions concerning your fertility journey. I know that there are a lot of couples who are listening who probably have started their journey thus far, for some time now, and they are wondering when it will all end. I want to say that what we seek to do is to foster a relationship on this journey, and we will work together. As someone who has been there before, I can say that by reason of experience, I know what it feels like to be in that state and to be going through this journey. All right, so I give a bit about my own personal journey. Like I said before, I understand what it feels like for couples who are trying to achieve conception. Many of you may not be aware, but for a lot of our patients who have come to know us, they know that I went through this fertility journey for about 12 years. I got married June 2002, and then waited for 12 years before our twins, Joshua and Jemima, came. We went through 9 IVF cycles in a 6-year period before the kids arrived. That means we had 8 failed IVF attempts. Although on the 4th attempt, my wife got pregnant, but she had to have an evacuation because the pregnancy was not doing well. And thereafter, she had a surgery, myomectomy, and then to the glory of God, on the 16th of January 2015, our twins were born. So it was a very trying time for us, and I haven't started this whole journey of taking care of couples about 9 years ago. I have come to understand that this is a journey that requires a lot of support, both from a personal experience and sharing the experiences of other couples too. I know it is one journey that requires a lot of support, and that is why we are glad to be there to ensure that we provide the necessary support for you on this journey and make you understand that you are not alone, on this journey, that it's a journey that may take a bit of some time. Ours took 6 years. There are some people's journey that I know that takes even longer than that. And there are a lot of them that the journey does not take that much. 1 year, 1.5, 2 years from when they start their journey, they already have their heart desires fulfilled. And that is where faith and patience become very important and critical. Bible says that through faith and patience, they obtained the promise. And so a lot of patience is required while believing that you would someday be able to share your testimony and have your children by your side. Well, it's important for us to know that it's not something that is rare. Infertility and the challenges of getting pregnant is not an uncommon event. In terms of statistics, 1 out of every couple will have difficulty conceiving. And that is why it's important for us to ensure that all the necessary support are provided, because there are so many couples now who are going through this journey to parenthood. Many have spent many years, and I've seen a lot of trauma as a result of this. Marriages fall apart, couples are not happy, just enduring life, all because they're not able to achieve their heart desire. And it can be very, very sapping and draining financially and psychologically. And that is why the burden of infertility is real. And so, for every couple who is going through it, I want to say that you are not alone, and that we would provide all the support that is required for you to be able to go through this journey. Having said that, it's important for us to note that the God has made the wisdom available that is needed to treat virtually every form of infertility. Those days when we're still in school as a young doctor, when I interact and counsel and consult with couples trying to get pregnant, that was before the advent of IVF. There are some cases that you will look at, and there's really nothing you can do for that couple medically. You just ask them to just trust God and just be praying, because the medical treatment at that time was not sufficient enough, was not comprehensive enough to be able to guarantee a success after a while. But today, all of that has changed. And we can literally say that if a couple is open to all the various options that will be made available, and they have the resources, the financial resources to go through this journey, that is just a matter of time, and then they will have their babies. So that is the only unfortunate thing about it is that the cost is quite exorbitant. The cost of fertility treatment, particularly assisted reproductive technology, is quite expensive. And that is why through the foundation, from as early as I can remember, we've always tried to provide some form of discount and some form of support to couples in terms of free circles sometimes, and very significant discounts to ensure that we're able to make this treatment affordable, because we understand the burden of infertility. And in our society, when a couple is childless, the burden is so much on the woman. All right. And so that is why the foundation was set up to be able to provide all of these support system, to try and ensure that um, couples who are going through infertility get the required support that is required. But it's important for us to also try and get some understanding as to what this infertility is all about. What is infertility? Well, infertility it's when a couple is not able to achieve conception after 1 year of regular unprotected intercourse. All right. For some women that are 35 and above, 6 months is the time lag that is given. After 6 months, you are above 35 years and you're not able to achieve conception, then we say that that's infertility. And you have two types, primary and secondary. It's important for us to note this because it also helps to determine the prognosis. So primary is when a couple has never achieved conception before, never. While secondary is when a couple have achieved conception, the woman has gotten pregnant before, irrespective of the outcome of the pregnancy. And the causes are generally divided into male and female. For the male causes, you have lifestyle, factors like smoking, alcohol, drugs, like cocaine, marijuana, infection, trauma, and then varicose. Varicose is when you have the veins that supply blood around the testis get engorged. That will increase the temperature and then reduce sperm production. Now, a major factor that causes male infertility is what we call idiopathic factor. Now, these are factors you cannot determine. All right, and you see a lot of men who come in, no obvious risk factors. They don't drink, they don't smoke, they don't use any hard drugs. You understand? No infection, nothing. No, I've really had an uneventful life thus far. No surgery, but surprisingly, the semen parameters are very, very, very poor. Such women, you actually, such men, you're not able to determine why they have such semen parameters. Then for the female factor, you have ovarian, tubal, uterine, and the pelvic factors as the main factors. For ovarian, any factor that prevents a woman from ovulating, from releasing her egg, will cause infertility. For tubal factor, if the tubes are blocked, any factor that causes that will definitely prevent pregnancy from occurring. And then you have uterine factors like polyps, uterine fibroids, submucous fibroids, and adhesions. And then, of course, pelvic factors like endometriosis. All right. So these are the causes. And for couples, it will be a combination of both, either male or female, or both factors will be there concurrently. All right. So basically, when you come into the facility, what we try to do is to identify what the possible cause is, but more importantly, is to begin to lay out what the treatment modalities will be for you to get pregnant. And just to also note that here at the Georgia Baby Fertility Center, we try to provide individualized and personalized care. Just a brief about our story for those of you who today is your first time of joining this forum. What our journey has been thus far. So, Georgia Baby Fertility Center, it's a center based in Abuja that provides comprehensive fertility care to couples trying to achieve conception. We started operations 22nd of June 2016, and this year we were 9 years, and we can say that God has been faithful. What was the vision? To become the leading fertility center in the world, running the largest number of circles with the highest clinical pregnancy rate, and our mission is to provide excellent and quality but affordable fertility care using state-of-the-art equipment with a well-trained and experienced workforce in a warm and loving environment. And that is what has kept us on our mission statement, to ensure that we always look at excellence, we look at quality. Our eyes are always focused on the result, on the outcome. Even when we are counseling our patients from the very beginning, we are looking at what are the best treatment options that will give us our desired result. Because we know that from when, please, can you mute your mic, please? Because we know that from when a patient comes to you to when they achieve conception can be quite a journey. So we try to reduce that time to as minimal as possible. All right. And so far, God has helped us. Over this number of years, we have attended to thousands of couples, and thousands of couples have gone through our consultation and counseling, and over 1,000 have gone through, thousands have gone through our fertility treatment, and hundreds of couples have been confirmed pregnant and have had their babies. To also know that the foundation was started. Please mute your mic. To also to also note that to also know that the foundation has also been working in collaboration with the clinic, with the fertility center, to provide services. To provide services. All right. So we've been working the split off. To also note that the foundation has been providing a lot of support to couples who are going through this journey: financial support, psychological and emotional support, spiritual support, and then education. All right. It's important for us to note that a program we started about almost 5 years ago, February 14th, 2021. The Be Fruitful project has been a huge success. And that program is coming to an end next year, 14th of February. It will be 5 years since we started that program. It was an ambitious program that we started to reach out to thousands of couples, 10,000 couples in a 5-year period, with very significantly discounted IVF programs, because we recognize that the major challenge, an area where couples need support, is in the finances. When we started that program, two circles of IVF was going for 500,000. That included the consultation, part of investigations, and then medications. And then there was an additional cost for other treatment options like third party. But it was a very, very audacious project, and God has helped us, and hundreds of couples have been blessed with the fruit of the womb, and today they've been able to overcome the scourge of barrenness. And you can see the reports from the Fruitful program. This is 4 years plus. Now, this slide was prepared some time ago. All right, this is the scorecard that we have. All right, but we know that many couples are still being challenged with going through this process. There are many couples who are trying to achieve conception. Many of them have tried IVF and it has not worked. And many are discouraged. Many are feeling hopeless. Many are wondering when their heart desires will finally be met. Like I often will say, IVF is not a 100 meters dash. It is not. It's not 100 meters. It's more of a marathon. And the way you run a marathon and the way you run 100 meters are two different things. So for IVF journey, the journey to parenthood, you require a lot of stamina. We are trusting God that God would help us to continue to provide a lot of support for couples on this journey. while we appreciate that the fruitful project will come to an end by 14th of next month, we are trusting God that the foundation will still continue to operate, and we will most likely come up with another project. All right, but I want those who are listening and who are online right now to please take advantage of this current program that is on. We're not sure what the form will be like when after the 14th of February, but I can assure you that the foundation has come to stay, and we will continue to provide all the necessary support. We are trusting God to also to be able to partner with individuals, with organizations, with groups, to be able to raise funds to help to lower the current cost of IVF for those who cannot afford much, and thereby making the IVF services more affordable. We're also trusting God too that we're able to provide access, because currently we are only based in Abuja. But we're trusting God, and in the new year, God will help us to be able to set up in other cities, so that patients will find it very, very difficult because of the logistic challenges to travel from one city to another, that we'll be able to reduce that burden as much as possible. All right, to reduce it as much as possible. I know that the year is gradually coming to an end. This is probably the last forum that we'll be having for the year, because by next month, Christmas period, will be so much activities. So I'm not sure we'll be able to have a forum. This is the last forum, and many people may be asking, can I still get pregnant this year? Why not? You can still get pregnant. It's not over yet until it is over. All right. So for those of you who have not come to start your journey, I will advise you to come and start off. No time is too late to start. Even if, based on your medical history and the analysis, we cannot start your program immediately, but it will be good that you have already started the process. You probably may need to be on some supplements, on some medications for a while to prepare your body or that of your spouse before you eventually go through the program. The bottom line is that it's important for you that you start. And for those who will be cleared, why not? You can trust God and believe that you would be able to achieve conception, even this year, because many of us at the beginning of the year, this was one of the major goal and major target and major desire. And I've come to realize that for couples who are trusting God for the fruit of the womb, if you ask them about their prayer points each time, number one will be this issue. And as long as that issue has not been sorted out, that will continue to be the number one prayer point. But I have no doubt in my heart that very soon that prayer point, that prayer list will change. That desire will no longer become number one, because it would have been fulfilled. For that to be done, it's important that you take steps. For those who have taken steps and they are on this journey, I want you, please don't give up. Oh, I know how it feels after the disappointment. Oh, I got pregnant, I lost the pregnancy. Oh, I've done IVF 3 times, 4 times, 5 times, 6 times. I've not gotten pregnant. What is happening? I know it can be very disheartening. But you see, but from experience, I've come to realize that as if you will not give up, that you will have your heart desire. Yes, you say, oh, doctor, that's for those who have the money. I don't have money at all. I understand the financial challenges, but you see, you have to keep it alive. You have to believe God that somehow, God will come through for you. And He does. He does come through. Right? And then you see that your heart desires will be met. I would say that just ensure you stay connected with us, because from time to time we do offer free circles to our patients. All right. It's important for you to remain connected so that in case so you could be a beneficiary. But I would say that for those who have never had gone through IVF before, trust God, work towards it. Believe God that it is your time and your season, and that you would, at the end of the day, succeed. I have a lot of couples who have gone through IVF a couple of times, just like the way we did, and I'm so impressed with their determination and their resolve to ensure that they see this thing to the very end, and they are committed to it. And I want to encourage others too who are going through the same journey to be determined, knowing that it is not your lot to be barren, that, oh, maybe God does not want me to have children. No, if He did not want you to have children, He wouldn't have said to us, be fruitful. He's expressly declared that we should be fruitful. We are meant to be fruitful. I know there are challenges that would have, hindered this from becoming a reality before now. But the good news is that those challenges can be overcome. It will require a lot of faith, a lot of patience, it will require a lot of resources, all right, but it is overcomable. And if you fail not, if you don't give up, I know you too that you will very shortly be able to overcome it. So I want to appreciate every one of you who constantly continues to be part of this our monthly fertility forum. I want to once again apologize for starting well behind schedule. I want to congratulate all of our patients who recently got pregnant through our IVF program. And for those who are currently going through the program, I wish you the very best. And for those who did not succeed in the circle in which they did, I say don't give up. Just keep hope alive. Trust in God. You will eventually have your heart desires. And for those who have delivered, I say big congratulations to every one of you. And then to those who are very heavy, and very shortly you will be going on to have your babies, I say congratulations in advance. And for many of our patients who are traveling out of the country to have your babies, I pray that you will send us baby pictures and everything would have gone well. Johnny Mercies is your portion. So I want to, before I conclude this section and we take questions, I want to say that every one of our patients, you are very valuable to us. We constantly pray for you, and we know that it may appear as if that day that you desire is very far away, but just know that it is closer than you think, and that God will definitely confirm your word in your life. So, thank you very much. A bit of today, I had to do a bit of exhortation just to encourage many of our couples who are going through a lot. I know that. To say, don't give up. God is on your side. All right, so at this time, we'll take a short break and then we will come back to answer any question that is related to fertility that you may have. And then we will have a nice time going forward. All right, thank you very much. I'll see you shortly after the break.
Many were weeping, many discouraged, many gave up hope on the dreams to parenthood because of the high cost of IVF. This is a story of hope. The foundation was set up to provide a support system to couples trying to achieve conception and has been involved in subsidizing and greatly discounting the cost of IVF treatments in the journey to parenthood of hundreds of couples. And today, many have received the abundance of joy and become joyful parents. 3 years ago, the Georgia Abebe Foundation embarked on an audacious project to reach 10,000 couples trying to achieve conception with IVF treatment in 5 years, called the Be Fruitful Project. After almost 3 years, the following are our good reports. Over 5,000 couples have had fertility consultation and counseling with our specialists. Over 1,000 couples have had IVF treatments. Over 450 babies have been born and over 400 have been confirmed pregnant, and many more still on their journey to parenthood. For these 100 confirmed pregnant, we say thank you, Lord. As we celebrate God in praises and thanksgiving for the amazing act of God in the last 3 years of the Be Fruitful project, we are confident that God is about to do more, as He has in turn turned many couples into joyful parents. For these 100 confirmed pregnant, we say thank you, Lord. For the hundreds of couples that will be confirmed pregnant this year, we say a big thank you, Lord. For the hundreds and thousands of babies that will be born to couples waiting for their bundle of joy, we say a million times thank you, Lord.
To begin their treatment program. That time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.
Covenant keeping God, I worship you today.
Thank you very much. Welcome back from the break. So we have a couple of questions here. I'll start with the first one. Good afternoon, Doc. I want to know if it is possible for one to be ovulating without seeing period for past 4 months now. All right, so usually a sign that you are ovulating is that you see your period regularly. A woman who sees her period regularly most likely is ovulating. And then conversely, a woman who is not seeing her period regularly most likely is not ovulating. Because when you ovulate and you release the egg, the shell that from which the egg comes produces a hormone called progesterone. It is that progesterone that acts on your womb that already has been primed by estrogen that will make you to see your period afterwards. So if a woman is not ovulating, one of the ways you will know is that her period will be very, very irregular. And if you're saying here that for 4 months you've not seen your period, and you're a woman who is in the prime of your reproductive period and you are not pregnant, then it's most likely that you're not ovulating. And the commonest cause of this kind of situation is what we call polycystic ovarian disease syndrome, where you have a woman who is not ovulating who is not seeing her period regularly, and of course she's not ovulating regularly, and that will lead to infertility because she won't be able to achieve conception, and there are also a lot of hormonal imbalances. All right, so I hope you got clarity with that question. The next question is, I want to know if it is possible for one to have children at 50. Yes, it is possible for you to have children at 50, but you need to also know that the treatment modalities for you will be modified because of your age. The woman who is 50 years old, the ovarian reserve would have been very, very low the quality of the egg also would be very, very low. And so the chance of using our eggs to achieve conception also will be very, very low. So for a woman at 50, she will definitely require the use of a third party, that means donor eggs, for her to be able to achieve conception. But it is mission possible. So thank you, Doc. I want to know if IVF is possible for people with endometriosis. Yes, it is possible, but you need to be able to deal with the situation and modify the treatment option because of the endometriosis. All right. So it depends on the type and the severity of the endometriosis. That will determine how easy it will be for a couple, for a woman to be able to get pregnant. But is it possible? Of course, it is possible. Okay, I saw your ad that is for 2 cycles, and I want to know the cost of the procedure. So for the costings, it depends on what program you are doing. Please, there's a form or a number there that you can call to make inquiries as to what the whole program is all about and what are the various costings depending on your program. But it's usually best to go through a consultation, all right, and have investigations done to it to be able to clearly determine what the additional cost will be. Okay, I'm 46 now. I want to do the IVF. Will I be needing donor eggs or use mine? If donor eggs, will more than one be used so that I can have a chance of having twins or triplets? All right, so for you, 46 years old, you'll be needing an egg donor because of your age. And usually for an egg donor, depending on what method of insemination we are using, we definitely will do more than one egg for you. So you do have a high chance of having multiple conception, because the aim for us is to try and transfer between 2 to 3 quality embryos. And so once with that, you do have a chance of having a set of twin or triplets, although we try to avoid that triplet because of the attendant risk. All right, so good is doc. Please, what is the success rate for a person who has high prolactin, PCOS, and a low progesterone? All right, so the most important factor that determines success is the age of the woman. So you said you are 34. 34 is not bad. You are just 1 year shy of 35, which is the watershed year, 35 years. So I believe that if you act now, you would be able to achieve conception. But it's important to note also that PCOS is also a challenge, because with PCOS, it means you will not be ovulating regularly. You will need to go through some treatment modalities. All right, and then also there's also high prolactin. The high prolactin will need to be addressed with medication, and then the PCOS will need to go through the various treatment modalities, whether it's we're doing ovulation induction or we're doing IUI or we're doing IVF. All of this all depends on what the medical record state concerning the couple. But it is possible. Now, as regards the success rate for these, well, we're looking at anything from 35-40 to about 45-50%. So what is the price? For the price, please, I would prefer that you call the front desk, or you call the number so that you can get details, because there are so many. The package depends on what program you are doing, particularly with the additional cost. So how to benefit from the foundation? I think there is a number that you can call. or there is a form that you can fill, and then we will get across to you. Okay, doctor, I'm very much interested. I want to know the total cost so as to help me prepare the bill for it. All right, so call our staff and they will give you all the necessary details as regards the cost. Like I said before, the cost depends on your program and what the treatment program that you intend to do. So calling our staff at the foundation will help you will guide you on what to do and what estimated cost you are looking at. So can IVF work for someone with blocked fallopian tube? Oh yes, it can. All right, that is the current modern treatment for blocked fallopian tube is IVF. But you have to also rule out hydrosalpinx and be sure that there are no fluid is not accumulating or did not accumulate in the fallopian tubes that will not track down and get into the endometrium, because with that it will make your IVF process to be challenging, and so because you will have recurrent fluid. It's important to state and to check and be sure that such does not exist. All right, so another question just dropped in. Doc, I want to know why the delay after recording 2 successful pregnancies. Okay, so what that means, you're having secondary infertility. Yep, so it depends. I'm sure that you are getting older, so age alone can be a factor. It's also important to also note what kind of delivery you had. Was it through cesarean section or was it vaginal birth? If it was through cesarean section, the surgery alone can predispose to adhesions and other factors that can hinder pregnancy. And if it was through a vaginal birth, then you want to rule out any infection, puerperal sepsis that could have damaged either the tubes or the uterus. All right. So it's to just be able to do a thorough evaluation to know what exactly was the cause, and then of course there are treatment options that will be available to manage the resources. Doctor, can a woman with fibroid go for IVF when the fibroid are outside the womb? Yeah, not all fibroids needs to be taken out. There are women who still get pregnant with fibroids. So it depends on the location of the fibroid, the size of the fibroid, and the number of fibroids that you have. All right, but yes, it is possible for a woman with fibroids to still go through IVF and get pregnant. So, good afternoon, Doc. Can someone with azoospermia do IVF? Someone with azoospermia. All right, so yes, it is possible. But what that means is that if you have azoospermia means no sperm cell in the semen. If it is confirmed that there is azoospermia, then what you want to first of all find out is to know what type of azoospermia you are dealing with. Is it obstructive or non-obstructive? Is the testis able to produce sperm at all, or the testes have completely shut down? Now, for situations where you are dealing with the obstructive azoospermia, or some cases of non-obstructive where the testis is producing sperm, you can do testicular sperm aspiration as part of the treatment modalities to get sperm from the testis of the spouse, and then you will do ICSI and inseminate the egg. But if it's a complete shutdown, that means the testes are not producing sperm, then you want to find out if such a couple is open to a third party, that is a sperm donor program. All right, so that is what we've done. So first and foremost is to evaluate thoroughly and find out what kind of azoospermia the man has, and then that will now determine what the treatment options would be. All right, so yeah. Okay, the one with the fibroid is 40. Yes, you can go through IVF. All right. All right. So just a minute. So let's see if there are other questions that are coming up so that we can answer them. While we are waiting, I just want to once again appreciate every one of us who have continued to follow us on this platform. To say well done, and I believe that the knowledge that you are gaining will be helpful on your journey or to help someone else. Good afternoon, Doc. Can misoprostol overdose affect fertility? All right, so it depends. Misoprostol overdose affect fertility. So misoprostol is a medication that is used to bring about uterine contraction and to complete an evacuation or to procure an evacuation, or if you want to have the body, the uterus expel a content that is on the inside. And so you will use misoprostol. When you use misoprostol, it causes your uterus to contract so that whatever that is inside would come out. Now, overdose of misoprostol will mean that you will be having very severe cramps. Yes, you'll be having very severe menstrual cramp, but when it does not affect fertility. After you've taken it and it has worn off, that is when after you have taken it and it has worn off, then effect will stop. So I don't think taking an overdose will affect your fertility, but be mindful that so if I'm sure this person who is asking this question probably took use misoprostol before at some point. I think you need to come for an evaluation. I don't think this misoprostol is the reason why you're not getting pregnant. So is there anything I can do to prepare my body for IVF? Yeah, there are a couple of things you can do. But the first thing is to first of all go through an evaluation, right? If you are someone who is still within the reproductive age group, you want to have ensure that your hormones are okay. And then depending on your age, you may want to start off some supplements. If you are overweight or obese, you may want to lose weight. And then for those who are polycystic, just sheer losing of weight alone and some other lifestyle modifications, you'll be surprised you can get pregnant. All right. And some of those supplements you may need to take them for upwards of 3 months. So yeah, it does pay to initially have a consultation and investigation and find out what exactly the challenge is and then manage it before you start off your IVF program. Okay, so doctor, my period is irregular. Most at times I don't know my ovulation dates, and it also be the reason for my infertility. Yes, it is possible. Like I said before, if you have an irregular period, it does suggest that you most likely may not be ovulating regularly. And so if that is the case, then yes, it is possible that that will cause infertility. Okay, so thank you, sir. I've done most tests. Do I need to do a fresh one? Yes, for us at our center here, we usually like to have our tests done ourselves. So even if you have done all of these tests before, if you're coming to us, we will require you to go through our own investigations. All right. So I'm 51, recently married, no kids, size, seized, seized menses, dry vagina, pain during penetration, low sex drive, ovarian cyst, adhesions. What are my chances? All right, so nothing is impossible. What you have just put here as mainly symptoms of menopause. You are 51 and then you have gone into menopause. So yes, as someone who has gone into menopause, you will experience vaginal dryness, pain during penetration, low sex drive, because your period would have stopped, but yet you still desire to have kids. That is possible. Okay, you mentioned ovarian cysts, that's not a challenge. Adhesions, so we need to know where are these adhesions. Are they in the uterus or are they outside the uterus in the pelvis? The bottom line is that you have a chance of conceiving. You come to us or meet a specialist who will evaluate you and then take you on the journey. Oh, we just found out we are both AS and still want kids. Wow. Yes, it is possible. Yes, you are both of you are AS. Yes, it is possible to have kids without the sickle cell gene. We can do a genotype selection for you. So you get in touch with us so that we can discuss the modalities of how to ensure that um, you don't have a baby that is sickle cell. Thank you, Doc. This was enlightening. Can we make payment instrumentally? Yeah, payment can be done instrumentally, but you need to complete your payment before your treatment program will start. You can speak with any of us, with our staff, so that they can guide you on the process and how to ensure that you go through the instrumental payment without having issues. All right, so another question is, what happens if IVF procedure is not successful? What happens is that you continue, no retreat, no surrender. You know, IVF, patients need to understand from the very beginning that IVF is not 100%. Nowhere in the world do they guarantee you that when you go through IVF that you will definitely have a successful outcome in that circle. No, because that was not the way it was made to be. IVF is not 100% science. So when you go through an IVF process, you have a 50% chance that it's 40 to 50% chance in some cases, or even 30% or 20% chance in some cases, depending on your age and other profile, that you will achieve conception. It therefore means that you have at least a 50% chance that it will not be successful in that particular circle. And that is why, with this in mind, when you go through an IVF process, we pray and trust God that it succeeds the first time. But if it does not succeed, you don't become hopeless and give up the whole journey entirely. Because the next program you will do may just be the program that is destined to be a success. All right? Doctor, Doc, I have a question. I know that was I know that the IVF was not done in your facility. My question is that I don't know why the IVF is failing. Oh, okay. So if you are having recurrent IVF failure, probably due to recurrent implantation failure, it's important so what will happen is that when you go to another fertility center is to have a thorough evaluation to find out how many times, to find out why the IVF is not failing, it means not working, particularly if you've done it 2 or 3 times consecutively and it has not worked. There will always be reasons why it did not fail. There are some obvious reasons why an IVF program will not be successful, and then there are subtle reasons why. For example, a woman who is above 40 who is using her eggs in an IVF program, most likely the quality of the eggs will affect the quality of the embryos. And most times you will not be able to generate that high quality embryo that will lead to success. So women who are above 35, particularly once they get to 40, the age of the woman is a major factor. And if the woman is not willing to embrace the third party option, then she may continue to go through that process without achieving results. All right, so that is one of the major reasons. Then there are other factors that can affect the uterus, because apart from the embryo, you want to also make sure that the container that the baby will grow in is also fine. And if that is not the case, then you will need to sort that out first. And of course, there are immunological factors. Air quality, embryo quality is fantastic. The womb is fine, but yet the couple is not getting pregnant. You want to find out what the immunological factors are like, because I know there are what we call natural killer cells that can affect and prevent conception from taking place. And of course, you have to check the uterus very, very thoroughly. Okay. I have 3 failed IVF in the course of my journey, not in your center. What do I need to do to have a successful embryo transfer? So, what you need to do is to start off the journey again. Probably go to a different center where you will have a detailed evaluation. And then, based on the evaluation, we'll be able to determine what is the best treatment option. All right. So they will take you through that, and then once we determine the treatment option that is best suited for you, we will go through it, and then I'm sure by the grace of God you will achieve conception. So, Doc, thank you. I've stopped my monthly flow. Can it be possible without monthly flow? Yes, it's possible. We will give you medications to make you see your period, and then with that, we'll be able to plan your program. So even if you have stopped seeing your period, all right, even if you've entered menopause due to advanced age and you still want to get pregnant, yes, it is possible for you to get pregnant. But we are going to be using the third party. We'll be using egg donor for that. So thank you, sir. Are there any cure or solution for shrunken testes for a man of 41 years plus? And does help work for infertility? So for the cure for is or solution for a shrunken testis. Now, if a testis is shrunken, that means it has reduced in size. Now you need to also find out why that is so, because there are some cases of shrunken testes that could indicate that no activity is taking place in the testis. Then in such a situation, there is nothing much you can do. But you could have a shrunken testis and the testis is still producing sperm. You want to find out and see what the parameters are, and see if with the use of supplement you can be able to improve the semen parameters. Help with infertility. Generally, I would not encourage the use of help, except of course if there are these supplements that already we have determined what the what the ingredients are, the elements that are in the elements that are in the supplement. And once they are safe and they are okay, why not? We will encourage you to continue with them. All right? But for these local helps, I will not encourage that. I'll be 50 next year, but my hubby will be 42 next year. Can I still get pregnant without a sperm without a sperm donor. Okay, so your hobby is 42 while you are 50. If you can get pregnant without a sperm donor. Yes, of course. Except, of course, if, okay, maybe it's the same person that wrote about the shrunken testes. Except, of course, if you have done your test, that is, your husband has done the semen analysis and they found nothing. Except that if you have tried, if you've done the semen analysis and there's no sperm at all, and they've done the biopsy or they've checked, you've used supplements and there's no available sperm to use, then you can use a sperm donor. All right. Okay, so thank you very much once again for attending this month's Fertility Forum and for sending in your questions. Quite a bit of questions today. Glad to answer them, and I hope I was able to provide some clarity to some of the questions. So this, like I said before, is our last Fertility Forum for the year. It means that our next one will be sometime in January or early February. I want to once again encourage those who are on this journey not to give up and to know that someday, very soon, it will happen and you'll be told congratulations as you have your babies in your hands. And for those who are still trusting that they can still get pregnant this year, why not? Rush quickly and get in touch with us so that we can see if it is possible for us to still take you through a program this year. And to all of our patients who got pregnant, I say congratulations. And for those who are going to be delivering soon, I once again say congratulations. I want to appreciate every one of you who joined in today and to once again apologize for starting late. And I believe that, I hope that we've been able to share a bit of information with you. So for those of you who want to get in touch with us, once again, there's a form there that you can click on and fill. And then once you do that, you submit, we will definitely get back to you. All right, so till we'll see again in 2026, I want to say a big congratulations in advance and to say thank you for joining on this Fertility Forum platform. God bless you. A great song to sing. So once I want to encourage those of us who are yet to begin their treatment program that time is going. There is no better time to start a treatment program like today. So pick up that phone and call the front desk and schedule an appointment. I believe God that by the end of this year, you will have a great song to sing. So once again, I want to wish every one of our clients a beautiful week, and I believe that we shall end this week rejoicing. Thank you and have a wonderful day. God bless you.